Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years of experience, to talk about hemoglobin A1C. What do the numbers mean? Sometimes it's hard to correlate a hemoglobin A1C to the sugar result. Patients are familiar with different numbers. They may know that an A1C of 6.5 is diabetic, and they may get an idea of where they want that hemoglobin A1C goal should be. But how does it correlate to an exact glucose level? The sugar level that you may see on a finger stick if you stick your finger over the blood, the sugar you may see when you maybe wear a device that checks the sugar, or just that what you will get on a regular blood test. So I usually use the numbers by going in 30 milligram increments of sugar. So for a glucose level of 90, I use an A1C of 5. For 120, an A1C of 6%. For a glucose level of 150, an A1C of 7. For 180, an A1C of 8. For 210, 9. For 240, 10. For 270, 11. And for 300, 12. So with a bottom starting point of 90, I add 30 to each sugar result, and then the A1C goes up 1%. So it gives you an exact idea. So again, if a person came in to see me today and their hemoglobin A1C was 10, I can guesstimate that their sugar has roughly been averaging about 240 over the prior 3 months. And those numbers are very helpful, again, especially if you're seeing new patients who may not give you a lot of information, or a hospitalized patient who may not be able to give you a lot of information about their sugar results at home. This information is very helpful. Now, just to give you an idea, I like those examples of raising it by 30 from 90 on up, because that roughly correlates to where it is. But there are actually some more precise measurements that will put that number to be within a couple of points of the numbers I'm stating, but I think the 30 milligram increases is something that we can remember.